Thank you. Thanks for having me today. I'm really excited to be here. Transition is a really important topic. I remember when I started in neurology and transition was an open committee, and so I landed on it, and I really didn't know very much about it. But the more I got into it, it really made me realize this is really important, and I honestly don't feel like we're talking about it enough. So I'm hoping that some of the information I can share with you will hopefully, if you're a provider, help you guide some patients, and if you're a parent, hopefully get you started and give you some ideas for resources. Hopefully at the end, we'll have a few minutes for questions or maybe comments so that we can share a little bit, maybe if there's stuff that has worked for people or hasn't. I do not have anything to disclose. I have no relevant financial relationships with any commercial relationships or interests, so I'm just here to talk with you guys. For my objectives, my hope is that you will understand kind of what transition is, what the barriers are, and what those barriers are to successful transition, to describe the legal aspects for a teen with disabilities at age 18. Things change right at 18, at 12:01 on the 18th birthday, and to encourage parents and providers to begin that transition process and provide some resources, hopefully, to get you started in the right direction. One key thing I really want to be mindful of is that this is an adolescent population, a young adult population, and we have to keep in mind that this transition is probably going to start and stop and go back a little bit and then go a little bit more and then slide back. And that's to be expected. It's to be expected. If any of you remember when you were an adolescent, you probably did those things too. So one thing to be mindful of this population too, that they're going to do that too. It's going to feel like it starts and stops, and that's normal. So what is transition? So the technical definition of it is the purposeful planned movement of adolescents and young adults with chronic physical and medical conditions from a child-centered to adult-oriented healthcare system. This definition was first, established in the literature in 2002. It was revised in 2011. And now that it's 2018, I still feel like we have a long ways to go on this. So it's really an important topic. It's usually kids age 18 to 25. Different organizations have different rules. Some have hard and fast rules that at 18 they're pushing kids out. Some are not. Some are a little bit more lax based on relationships that we have. And sometimes with specialists like neurology, we see that we tend to hold on to our kids a little bit longer. We love them, we don't want to get rid of them, but also from the parent standpoint, it's also hard and it's scary. So the overarching goals of what transition should look like, we want it to be high quality, patient-centered, flexible, continuous. I think this is one of the most important parts, in my opinion, of transition, is because it's a pretty bad feeling that you've been seeing your doctor for 20 years and all of a sudden you're like, okay, it's time for you to go. That's a terrible feeling. So the continuous process is something that we need to work on. Parents need to work on it and providers need to work on it so that it can be a process and not just a hard stop, because that doesn't feel good. And it doesn't feel good to providers either. We've cared for you for a really long time. Our heartstrings are still attached too, so we have to kind of break that evenly and nicely, hopefully. We want it to be responsive to the needs and desires of both the patient and the family. That's also part of that teamwork process that has to happen. And the goal of it, too, is to enhance the sense of self-determination and self-advocacy, whatever that means for that patient. It may be something small, it may be something big, but whatever it means for that patient and for that family. So this is actually a study. I'm not going to talk a lot about the study because I think the premise of why it's important is more important in my talk. So this was a study they used, it was nationwide in the US, and they used data from 2008 to look at kids, or this population, 18 to 25, when they were in the ERs with chronic special needs. What they found was that population with complex medical needs used the ER more than they did like a specialist or a primary care provider. And so what this study, in my opinion, really highlights is that we really need to focus on this transition piece so that we can keep kids out of the ER and have them have their medical needs met more long-term and more beneficial through specialists, through primary care providers. So, the 6 key elements that are needed for transition. This is in the literature, and I would say this slide, initially when I did this talk, I was thinking, this is a good slide for providers. But then I thought, parents need to know this too. When you need to be, these are things as parents you want to be looking for in your child's specialist, in your child's doctors, to see, is this happening? If not, ask about it. So the 6 things are that, ideally, a transition policy will be in place with a guideline of how things should go and how we can make that more of a continuous process instead of just like, oh, it's the last time, it's time for you to go, here's your medical records. Also, a registry, a way for us as clinicians to monitor that progress. Dr. Knupp talked about the pilot program that's going on in neurology, and right now we're working, I'm really proud to say actually that the hospital is kind of pushing out something hospital-wide. It's a tool, it's called the transition tool. And the idea is that each specialty, each area of the hospital that a child goes to will document what they are doing to get this child ready for transition. So are they working on, do they know their medications? Do they know what their meds are used for? Can they make an appointment? Could they do a refill? Anything from small to large, are they ready to make that appointment? But the idea is that we're making sort of a registry or a tool so that we can see, like in neurology, what we're doing for our patients, but what's cardiology doing, and is that child ready to go across the spectrum, or maybe they're just ready to go to a neurologist but not a cardiologist. So that's an important piece. Preparation. One of the things we're doing is a readiness assessment, is that when our kids are coming in, if they're over 14, we are starting to ask questions, either to the families or to the patient, depending on what the child is able to do or not do, so that we can see where they're at and kind of start gauging that readiness, start thinking about stuff. Planning. It's important to talk with your providers, your specialists, your primary care physician, to get a plan in place. What kind of goals are you hoping for your child, or as a provider, what are you hoping for that patient? Where do you think they should, what should that family be thinking about? Start that dialogue early so that it doesn't feel like it's that last minute when you're getting ready and it's almost time. So then also transfer of care is one of the actual elements when we transfer those medical records and stuff. And then the completion is attending that first adult visit. So some barriers. There's a lot of barriers. There's probably a lot more barriers than this. And I think individually, some people have different barriers than this. This is just a pretty generic. Patient barriers. These patients are complex. They have a lot of medical needs that we need to try to meet and get them set up with a provider that can help take care of them. They might have developmental or cognitive delays, which makes it more challenging. They can't advocate for themselves once they're 18, even though the law says they might need to. There's also social barriers, emotional, vocational, insurance. Insurance is a big issue. The insurance will dictate where you can go or where you can't go. The family barriers. I think this is kind of what tugs at my heartstrings, because one, they have limited resources and they're limited time. It's hard. I have kids that are just they're going to college and they're teenagers, and I'm like, oh, I need to be thinking about some of this stuff too. And so sort of that realization, I feel like it happens so fast. And I think that probably happens to all of us too. And also the fear of the unknown. We trust our pediatric providers because they've been there for us for a really long time. And it's scary to know, will that person take quite as good care? They will. We just have to make sure that it's the right fit. And we have to do all of these things to make a plan and figure it out so that they can. Then there's provider barriers. Let's see. With sometimes the organization, the processes, setting up those 6 things that I just talked about, and then the system barriers too. Sometimes it's hard to set up all of those things from just a logistical staffing even, and clinic flow. So we're going to move into some of the legalities. As you guys know, when the patient turns 18, it changes. It's an instant difference on how care is accessed and it's received. They're legally considered independent on their 18th birthday unless there's documentation otherwise. So that changes medical decision making, and it's also important at this point for parents to start thinking about guardianship or medical durable power of attorney, which we're going to just talk about here in just a minute. And it's an important role to talk about it as a team. You want to talk about it with your providers, also, so that they will have access to resources. Maybe it's social work, maybe it's resources within the community, maybe they know about programs that you might not know about. But it's really important to open that dialogue and open it early. The earlier you start asking questions, the earlier you can start making a plan, the better options that you have to figure out what you need to do. So guardianship. And so these are technical definitions, but basically guardianship is an adult that's appointed by the court to oversee and manage personal matters and decision-making of a minor that's not able to. A person aged 21 or older can be appointed as a guardian. This can include decision-making, living arrangements, basic needs, and finances. It might include working with the courts on a personal care plan, living arrangements. You may even have to have permission to travel outside of the state. But if this is what you need in your situation, these are the questions you want to be asking. So another option is the Medical Durable Power of Attorney, or MDPOA. This is a designation made in writing by a mentally competent adult, age 18 and over, that gives another adult, 21 or older, the authority to act on his or her behalf as a healthcare agent, making decisions in the event that they're not able to. This was sort of one of those aha moments when I was doing this presentation, like, my kids are 18, I've got to do something, I need to work on this. So again, it happens so fast, but who should have a medical durable power of attorney? This, in our transition committee, we put together a booklet for our patients that helps to describe some of this stuff, and that's where the last slide in the slide actually came from. We worked with an interdisciplinary team with our social workers to help, and we're lucky here on staff that we have social workers that can help navigate our families through this. So ask, because there are resources. So a medical durable power of attorney is any mentally competent adult, and it's good for someone who has a known medical condition, maybe not with lots of developmental concerns, because it's really not appropriate for a patient with significant developmental delays, but it might be appropriate for someone else. So it's, again, worth asking. So I just really liked this slide. There is ability in every disability. So how do we figure out what that is, and how do we give these kids a little bit of independence in the way that they can? What's appropriate? So this is a transition plan, which I'm going to kind of breeze through this, because this is just an example. For your family or for your patients, it's going to look different. That's actually the goal. The goal should be that each patient looks just a little bit different, because it shouldn't be the same for everyone. Everyone needs different things. So in thinking about how they can become independent, think about a safety plan. Maybe it's an ID bracelet. Maybe it's a list of emergency contacts. Maybe it's some other things that they can do. Think about what they can do, not what can they not do. You want to look into job training programs, talk with your schools, talk with your primary care, your neurologist, the people that you have as resources. They will know about resources within your community that can help you. You want to look at long-term planning. Again, I can't say it enough, start early. Might be short-term depending on the age of your child, but look into guardianship, medical durable power of attorney, disability benefits, possibly social workers, those resources. Consider a special needs trust. This was something I didn't know very much about, is that it is actually a trust that's set up to protect the finances of the family, but also allows for continued support for the patient long-term, which I thought is pretty cool. And I think our social workers would be who I would reach out to ask more about that, because I don't know enough about that. So insurance, again, you're going to need to look at that. The action steps medically, talk to your caregivers. Make it a team effort. It shouldn't just be parents. It shouldn't just be providers. It really needs to be a team effort. That's really important. And then once you have picked, or you've decided where you think that the next stage is going to be, what the next neurologist is or who it is, talk to your neurologist, so that way they can help you coordinate getting medical records, getting appointments set up, doing all the things that you need to. Everything is in order. So it's a little bit of an easier transition. There are some places that actually do transition clinics where they have the adult providers come over to the pediatric side, and which is a really nice meeting where as a family you can meet, you go to your neurologist, but you might also see the adult neurologist too at the same time, and it can make you feel a little bit better. Kind of gets rid of that unknown because you know who that person is and that they have a collaboration with your provider. So it's not everywhere. In the literature it looks like that's kind of, there's a little bit of push in that direction, but it comes down to a lot of those barriers that I talked about before. So, things you can think about. Think about what can my child do rather than what they cannot. It can be simple things. Putting meds in a pill bottle, putting ice in your phone in case of emergency, a safety poster with things that they can do maybe daily or weekly, depending on what's appropriate. The other piece too that is, don't forget about them taking care of their own health. Nutrition, sleep, exercise. Those are really important things too, not just Dravet, not just everything that encompasses. Social relationships, I know the person that was speaking before me was talking about puberty. It's real, and we can't not address it. So in the ways that is appropriate for your situation, address it. There are resources within the community. They have classes for kids, for young adults that are not living independently. The picture here, I don't know if anyone has seen this. It's probably my favorite. I don't watch a lot of TV, but it's on A&E. It's called Born This Way. It is a series about a group of young adult Down syndrome young adults, and they are transitioning. And as a parent, it was really eye-opening to watch it because they're really talking about these transition types of things, moving out or getting care or finding out where they need to go, asking some of those questions as parents that naturally come up. So it was actually one quick thing they had two of the kids wanted to go on a date, and the parents were going back and forth. This, I don't feel comfortable with this. How are we going to do this? This doesn't seem right. What should we do? And so the moms just decided to take these two kids to Starbucks, and the kids went and had their date, and the mom sat in the corner of the restaurant and chatted. And it worked out perfectly, and I was like, I hadn't even thought of that. And so it's just, I think the good news is there's more things out there. That since this has happened since 2002, and then it was revised in 2011, and now it's in the media a little bit more, there's more resources out there, and people are more aware of it, which is a really big thing, and I think it's good. Before I switch to the next slide quickly, respite care. I just want to mention how important it is to think about yourself. We do, as parents, as providers, we do everything for the kids. We do everything for those patients. It's really important to think about yourself and what is also consider your needs as far as, like with the siblings, find that balance. It's an important piece. So I was like, I think I'm running out of time, so I'll try and go quick. This is the resources part. So again, thinking about what you can do in your situation. Look around your community. Where do you see people with disabilities working? Think about corporations. When I jumped online to look up stuff, I was amazed at some of the stuff that I found. It was hard, and I wish there was one place where you could just go and look, but that didn't happen. I actually found one of the things I thought was kind of interesting was Embassy Suites had hired in Maryland at Chevy Chase Hotel some disabled adults to do different things throughout the hospital, or not the hospital, the hotel. And it was really interesting, but it made me think, that's not a place I thought I would look initially, but it made me think outside the box. Look in your community. Where else can you look? And there was two examples that I found online. River Terrace Workforce, which is in Washington, D.C. They had a campus for special needs families and kids, but there was some other resources. It was kind of cool to look at. Also, Laredon, which is here in Denver. It said on their website, providing life without limits. So just some resources here locally as well. So putting these pieces together are hard. This, for me, is probably the most important slide, I'm hoping, to you all. When I got online, I would find one website and go, oh, this is great. But then it would lead me to another one, and then to another one, and then to another one. And it did become overwhelming, but I found, I think, 5 good, maybe starting points. There's the Workforce and Innovation and Opportunity Act, which is a government site that links to resources throughout the country. Career One Stop is another organization that has resources for disabled workers throughout the country as well. Vocational Rehab is through the U.S. Department of Education. It has funded programs in every single state. And what I liked about this website was that each state was listed and there was contacts for each state. And so like when I pulled up Colorado, it took me to a completely different place with a lot of other resources. And so these may not have all your answers. And so actually I should tell you, I see you taking a picture. I did make a handout. It should be with my presentation, and it does have these resources and then like the medical durable power stuff on the back too. So you can take pictures of it, but you don't have to. This may not be the end-all be-all, but it might open your eyes to some resources. The fourth one is the Disability Employment Initiative, which this one was pretty interesting because it was grants from the U.S. Department of Labor. There was actually like a map of states that had where the grants were in which states, and then if you clicked on it, it talked about, you could pull up and read about each grant. And this, in my mind, this one said, this is an opportunity to work with someone to come up with a grant to figure out what might work in my situation. And so I thought, to me, this one was a little bit eye-opening. I hope that it will be. Number 5 is TANF, and WIOA is really number 1. But TANF is Temporary Assistance for Needy Families. And there is priority that's given to populations with disabled adults, which I did not know that. I'd heard of TANF, but I did not realize that they gave priority to disabled adults. So that might be a segue to kind of look into other resources too. So I'm almost done. I have 2 slides left. So some other resources. The Dravet Syndrome Foundation has great resources. I'm sure you all know that already. Their Facebook page, when I got on, I was like, oh, I'll just put it in their Facebook page, and they just kept coming up. And I was like, that's pretty cool. So there's a lot of resources there. GotTransition.org is the nationwide transition website. And there's a lot of really great resources on there, too. Depending on what you're looking for. It's an amazing website, so I would say check it out because for providers, it's fantastic. For families, it's also good. Again, it's kind of depending on what you're looking for. Attending conferences like this is really important. This networking, you guys, I'm sure, have met a ton of people and shared a lot of information, and I think that's really key, too. Like I said in the beginning of this, we're not talking about transition enough, and places like these and forums like these encourage us to talk about it and share with one another about what's working and what's not working and what resources are out there. And I think that gets us all thinking and hopefully helps us in our own situations. So, the conclusions. Transition is essential in achieving effective outcomes for patients. When our patients transition successfully and they have a provider that they can go to that will help manage their problems, their diseases, their illnesses, research shows they do better long-term. They're healthier long-term as adults because they know where they can go to get care and they're not just ending up in the ER that's just going to stabilize them and get them out. So that's a really key piece. It is challenging. A team approach is necessary. And again, ask questions and start early for whatever is best in your situation.